You just tore your pec tendon and now you have to have surgery. This is everything I went through: anxiety, depression, fear, everything, and how to deal with it. I have 10 points I'm gonna run through. You can skip through the video depending on what stage of the process you're going through. All of my information is from an orthopedic doctor here in Utah and from my experience. You tore your pec tendon. You need to figure out if it's a partial tear or a full tear. Partial tear is nice and better, but it's also less of a percentage and less likely. It's more likely it's a full tear. Pre-op. Do your best not to move the arm and try to get that surgery scheduled within 2 to 3 week mark. The longer you wait, the worse it's going to be and the harder it is for them to pull that tissue and tendon and reattach it to the bone. So you want to get a sling to hold the arm up, and I would recommend sleeping with a pillow in between and getting some antibacterial wipes for your armpit. If you keep your armpit closed for too long, it starts breeding bacteria and it's going to start smelling like sour and weird. So antibacterial wipes like wet ones. Wipes like wet ones are, I'm not sponsored by them, by the way. I'm not shouting them out in any type of way. They are just the cheapest and best antibacterial wipe I found. Wipe the area, let it air dry, and then try to keep it open and dry as often as you can. You'll also probably get a heat rash if you don't open it often enough. So don't try to raise the arm or externally rotate. You just want to try to open it about here and just let it air out so you don't get heat rash or any bacteria breeding in there. Try to get outside and walk around at least. Try to get moving. Don't sit around for too long. It's bad for your mental health and bad for your body. So try to stay active and at least move around. Try to look for people who have gone through this surgery and this operation and injury, either on Facebook, TikTok, or Instagram, or YouTube. Just try to reach out to them, talk to them, and see kind of how their operation went. Try to get some information from them, and just know you're not the only one going through this. Many people have gone through this. Do your best to rely on your friends and family. I'm kind of antisocial, but I reached out to my friends. I don't have family here in Utah. I reached out to my friends to help me. You can rely on your friends to help, and don't be afraid to ask them for help. Last thing, know that your arm will atrophy, and your chest and shoulder, because you're not using it. It's going to be immobilized, so it's going to atrophy at a pretty alarming rate. But don't worry, you'll get it back, you'll gain it back. Your muscle memory will help with gaining the muscle back. You'll get newbie gains, so don't worry about losing the size. Just don't move the arm, let it heal, let it do its thing, listen to the doctors, and know you'll be back to 100% as long as you just listen to what they say and you don't push yourself. Okay, your surgery is scheduled. A lot of people have anxiety, so it's just a fear of not knowing. It's not really fear in general. I wasn't really afraid of a lot of things. I'm not really afraid of a lot of things, but the fear of the unknown is big for a lot of humans. So just having anxiety and fear of surgery, if you've never had it before, is very common. It's normal. It's going to be okay. I'm also afraid of needles, and I don't like anything operating. Like, I don't want someone operating or opening me up. So I have that fear. It's normal. It's going to be okay. My fear was moderate. I know some people will be higher, some will be lower. So this is all depending on you. My biggest fear with surgery was going under anesthesia. I had never done it before. And the fear of the unknown, of being knocked out and not being conscious and not having any control of your body, is pretty scary. So my fear of that was pretty moderate, and I had a bit of anxiety around that. So it's okay. People have it. People have this fear, and you can work through it and not like, you can work through it and you don't have to be as anxious or afraid. All right, what the surgery will be like. They're gonna cut you open pretty much from here to here. It's a pretty small incision, nothing crazy. And they're gonna grab your tendon and reattach it to the bone. The new age style is they drill holes in your bone and they attach buttons and then sutures. Older style would be screws. So you want the buttons, titanium buttons, and they won't go off like at an airport or anything like that. So pretty sleek, not really noticeable, and you won't feel the pain in the bone or anything like that. You can actually look this up online and see the entire the entire operation where they pull the muscles to the side, pull the skin to the side, everything. I wouldn't advise that if you are squeamish or don't want to see it. So don't go looking for it if you don't want to see it. But if you do and you are curious, I found a lot of research on how exactly they do it, how they suture it to the bone. It was a little bit for me, but I wanted to kind of know how they were doing it. Surgery anxiety and how to deal with it. This is the biggest part of why I wanted to make this video, and it's very common to having anxiety over this, and I didn't see a lot of content made around the anxiety of surgery and the fear, and that's the number one question I've been asked on Instagram is, how do you deal with the fear and the anxiety of the surgery? So there's not much content on this on the mental side and on the fear side of this surgery. They're mostly going over the logistics. So this video was created for the anxiety, for the mental side of it, and kind of how to combat that. So the first thing I would say is start doing some meditation. If you've never done it before, you just sit quietly and think about your feelings. It's weird, it's not normal for people who know nothing about this kind of stuff, but just sit somewhere quiet and just think about the feelings you're having and that are coming up based on the surgery, based on your operation. So fear, anxiety, depression, sadness, whatever you're feeling, just let those feelings kind of come up and just try to think about and feel them. It's okay to feel them. Once you've started feeling these feelings, start asking yourself why. Why do I feel this way? Why am I anxious? Why am I scared? Why am I fearful? Why am I sad? Why am I feeling this way about this operation? Allow yourself to feel these fears, allow yourself to feel these feelings, and then start embracing it. So courage is embracing and facing the fear you have. Fear is okay, but you need to learn how to face it and have courage. And it really helped me to kind of tell myself to be courageous and have bravery and have courage and just face this fear of not knowing what this is going to be like. When I was feeling anxious throughout my time before the operation, I would just tell myself in my head, just like, be courageous, have courage, have courage, have courage, over and over and over. And just telling yourself to have courage and to face those fears kind of really helped me embolden myself and kind of lowered the anxiety for me. If this doesn't work for you, just try to keep your mind busy. Play video games, watch TV, get out with friends, do anything you can to just kind of keep your mind off of focusing on the anxiety of the surgery and the injury. The day before surgery, you'll need some good rest before the surgery because your body is going to go under a bit of stress just from being cut open and worked on. So you need to meditate or do something that calms you down and that will let you sleep before the surgery. Just try to reassure yourself, talk to yourself, and just reassure yourself everything will be okay. If you're young, you're going to go through this without any problem. You're going to wake up perfectly fine. If you're older, consult your doctor. They'll tell you the risks involved. But I'm 28 years old. I'm not super young, but I'm young enough. And I had no issue going through this. If you're healthy, if you're working out, the better it is. So don't sit around. Make sure you're walking, keeping your heart rate up, staying healthy, because the healthier you are before surgery, the easier it will be for you to wake up and get through it. Also, make sure you follow all of your doctor's instructions on what to do to prepare before the surgery that night before. So you're probably you won't be eating, you probably have your last meal at 12 o'clock, depending on when your surgery is the next day. And you want to do clear liquids about 2 hours before the surgery. But just listen to what they say, shower with the antibacterial soap, whatever they say, do it to a T, listen to it, and don't eat, because it'll help the anesthesia get through your body the right way. If you eat before, I think it messes with the anesthesia, and then that could be a big mess. So just listen to your doctor's instructions. Surgery day, face the anxiety and the fear. You got this. Remember to breathe and have courage. So breathing has helped me in a lot of times in my life. Just deep breaths, 4 seconds in, 4 seconds out, and then 4 seconds in, hold it for 4 seconds, let it out for 4 seconds. That's the easiest way to slow your breathing down, slow your heart rate down, calm yourself down. Breathe. Just remember to breathe. I'm afraid of needles. I'm afraid of the IV. I've never had an IV. So what I did is I talked to the nurse who's doing my IV. They put it in my hand right here. It was fine. It really wasn't bad, but I kind of talked to them, had them talk me through it, and It was honestly super easy. I didn't feel the IV start at all. They put it in. After they put it in, it's like a light pinch, and then it feels weird being in there. It kind of made me feel a little weird, but other than that, you don't feel anything else, and it's perfectly fine. So don't stress about the IV if you've never had an IV or you don't like needles. It wasn't a big deal. They actually taped it in place so it wouldn't move, so I didn't feel it moving around in my veins or anything like that. So yeah, you got this. So once the IV is in, you're sitting in the bed, you're just waiting to be wheeled into the OR basically. So try to watch some TV, play on your phone, do something like that, and try to have someone there with you. I don't know what your situation will be like, but having someone there just really helps. They can hold your stuff, be there when you wake up, and you have to have someone drive you home anyway. So having someone there is just really nice, and it keeps your mind kind of occupied so you're not like stressing out. So watch TV, have someone there to talk to, or play on your phone. Heading to the OR and the anesthesia. Before you head into the OR or do anything like that, the surgeon and the anesthesiologist will come and talk to you. They will go over the operation, what they'll do. You can ask questions to ease your mind, whatever. They will come and talk to you and give you all that information before you go in. The anesthesiologist will usually be the one wheeling you in, or at least for my case, they were the one who wheeled me into the OR. So they're the last person you'll talk to, and you can ask, like, hey, are you the last person in, or are you gonna wheel me in, or whatever. On the way to the OR, just breathe. You're in a gown, so that was weird for me. My gown was like blowing up. I was like, well, I hope no one is seeing anything, but I just try to keep my legs down and just breathed as they pushed me through the hallways to the OR. So they will let you know before they apply the anesthesia. It's not going to be like out of nowhere. Before they apply the anesthesia, they wheeled me into the OR. So the OR was really cold. I guess it just has to be cold. I don't know why. I'm sure there's some type of reason, but it was cooler. They wheeled me in there, and they had me switch over to the operating table. The operating table was not what I was thinking. I was thinking it's like going to be this hard metal table, and I'm just going to be laying on it. But it was actually a padded table, super comfortable. I switched over, no issues there. And usually the anesthesiologist will either give you a countdown or tell you to take breaths. Mine just told me, hey, we're going to start it soon, just get comfortable. Someone put an oxygen mask on my face. I started breathing, and then I was out. So they didn't have me count down. I think I prefer that rather than having the anxiety of having to count down or take deep breaths or whatever. They just told me to breathe, and I was out. So I prefer that. Maybe you can ask them to do that. I'm not sure, but depending on where you get yours done, that's what they did. And it was super quick, super painless, and like I wasn't anxious at all. How the anesthesia feels. Okay, so this is really weird and for people above age, but if you've ever been drunk, it's actually super close to that. So alcohol works as an anesthesia, but you would just need copious amounts of that. So they use anesthesia instead that's directly made to enter your body and act quickly. But if you've ever been drunk and like fell asleep, like being pretty drunk, it feels just like that. Like you just kind of fall asleep, and it's super painless, super chill. Like it's probably the best way to fall asleep in my opinion. So yeah, you just fall asleep and then you wake up right after. Like it feels like 5 seconds, not even. It feels like you just fell asleep and then you wake up. Alcohol affects the brain just like the anesthesia does. So it feels just like you're really drunk or just like really impaired. The anxiety I had around the anesthesia was more of like the action of going under rather than the effects on my body, because I knew it was just like alcohol. So I've drank before, so I kind of knew what it would feel like. So I had the anxiety of just like going under and not being able to wake up, but it was a super seamless process. I fell asleep and literally like seconds later I woke up, felt fine, and was just groggy, but I felt like it took 2 seconds for the whole operation to happen. Waking up, I felt super tired and heavy. My body felt heavy. I woke up in the PACU. I woke up to the sounds around me, and a nurse came over and asked me some questions. My brain felt really sharp, but my mouth was not getting it out. I was slurring my words like I was drunk. So she was like, I'll give you a few minutes and I'll come back and ask. So she did that a couple of times until I was able to clearly speak to her and tell her what time it was, like what month, my name and birthday, everything like that. That took about 45 minutes. I was in the PACU. I'm not sure if you will go there, but I went to the PACU and then I was able to see the person who was with me. So I was in there for about 45 minutes and yeah, just kind of getting my brain to get running back and get on track. But my brain felt sharp, my mouth not so much. So I think I'm more waking up the body. As I was waking up, my eyes were closed and my brain felt on and felt sharp, but my body was slow. So my legs felt really heavy, my arms felt heavy, and I just gave it time and just slowly tried to move my hands. I didn't move my operative side at all, but I moved my left hand, squeezed, and tried to lift my legs and kind of move them around as I was waking up. My throat was actually a little sore because they put a breathing tube down my throat during the surgery, but it wasn't too bad, and I think that's kind of why I was slurring my words and couldn't talk super well at the beginning. But after a little while, the soreness went away and I was able to talk clearly. Once I was able to speak clearly, they wheeled me into the next room where I was able to meet the person who was with me and driving me home. So they gave me some pain meds and they gave me some ice, and I just laid in the bed for like 2 hours until my body was able to, like, I laid in the bed for about like 2 hours and they kept coming in and checking on me, gave me some food and stuff like that. But I wanted to make sure I could move my body fully before I got out of the bed because I didn't want to cause any like movement in this area. So I waited until I could lift my legs fully and felt strong enough to be stable. I know some people kind of like feel like they can kind of move their body and they're like, okay, let's go. And then they get out of the bed and they fall. So I didn't want to fall. I waited until my legs were fully able to move, and you can wait as long as you want. If you want to be in there and get out of there, like if you want to get out of there quickly, you can do whatever you'd like, but I wanted to wait until I could stabilize my body. So my legs felt heavy for like the first hour or so. I kept moving them over and over and like closing my eyes and just like coming in and out, like just waking up and waking my whole body up. And I just waited until I could lift both my legs and to the point to where they didn't feel heavy and I felt like I could stabilize myself. And then the nurse helped me out of the bed, put me in a wheelchair. I kept my shirt off and I was just wearing shorts, so I changed into my regular clothes. But I kept my shirt off because I didn't want to move the arm. So yeah, if you don't want to be shirtless, bring like a robe or a jacket that you can throw on over you. But yeah, they wheeled me out and that's when I went home. I can make another video kind of on the whole process if you guys want, if I get comments or people asking, but this video was for the anxiety of the surgery. If you guys want information on the recovery or anything else other than like the anxiety side of this, feel free to message me on Instagram or comment in the section here and I will try to get back to you guys. Stay merciless.